There has never been a perfect science when discussing and treating opioid withdrawal. So in this video, we're going to be discussing some treatments of opioid withdrawal or even just addiction in general. And we're going to be talking also about an alternative non-FDA approved treatment. And just so everyone knows, I am not against any treatment or medication treatment. But I also think we need to discuss some of the alternative treatments as well that are out there that have been shown to help people. I'm not a doctor, but this is just strictly based off of what I've seen in the psychiatric setting and what I've seen help others in general. So first, for opioid withdrawal or addiction, we need to establish there's no easy way for somebody to go through the process of withdrawing and addiction. It's very subjective from person to person. Yes, we can kind of predict, depending on the substance, what some of the physical withdrawals will be. Extreme flu-like symptoms, vomiting, extreme restless leg. Some of those symptoms we can assume more than likely will happen. But the trick comes, and this deals even with just addiction in general, is not the physical withdrawal, more so the post-acute withdrawal is typically the aspect that is it's not easily understood to this day, because everyone goes through the process at different rates depending on underlying trauma, addictions, other addictions, just your brain chemistry in general. Everyone's different. So obviously we know of things such as Suboxone, Subutex, Methadone. One thing we do know today is a lot of times today there are a lot of physicians who feel more comfortable prescribing if somebody's coming off of heroin or has a history of using or abusing pain medications, to put them on Suboxone or Subutex. And now it's even becoming more clear they like to put people on Suboxone because it has naloxone in it compared to Subutex. Suboxone and Subutex are partial opioid agonist, meaning you're getting half the effect. It's not a full opioid agonist when compared to something like heroin or even methadone to an extent. It's stronger than Subutex or Suboxone. But we do know today that Suboxone is something for opioid withdrawal has been shown to dramatically help. Now with that though, there are people who, even if that have an allergy to Suboxone or Subutex or are allergic to it, and can be thrown into really bad precipitated withdrawals. And what I mean by precipitated withdrawals is, let's say somebody goes to the emergency room and they've been abusing heroin or fentanyl, full opioid agonist, a lot more powerful. It takes that full opioid receptor in your brain. Let's say somebody comes into the ER. Well, a lot of times what they'll do is they'll put them on Suboxone, and the physician will be like, well, when's the last time you used heroin or fentanyl? And they'll be like, sometimes the person will lie, but let's just say they're being honest. Let's say they're like, 48 hours ago. Okay, well, now I can give you some Suboxone. They take it and they're thrown into precipitated withdrawal, because what the literature shows today is if you've not had fentanyl for 24 hours or heroin for 24 to 48 hours, you can go ahead and take Suboxone, because if you take it before that time frame is up where it's still in your system, Suboxone will throw you into precipitated withdrawal, which is a lot worse than the actual withdrawal you would get from fentanyl or heroin. Projectile vomiting, you can't, it's terrible. And anyone who's been through precipitated withdrawal knows exactly what I'm talking about, how it's terrible. Flu times 100, let's just put it that way. It's painful. It's a very painful process. But one thing with this though is, let's say they haven't used fentanyl in 48 hours. they go ahead and take a Suboxone, but they still go into the precipitated withdrawals. There are situations where that happens, where once again, body chemistry just being different, yes, we have an idea of what precipitated withdrawal is, but it's happening more and more with it, in particular with the fentanyl getting stronger and stronger out there, that 48-hour cutoff mark isn't efficient enough. And what's happening is they're taking Suboxone and they're being thrown into this, and they never want to take Suboxone again, or Subutex for that reason. And to top it off, Suboxone has naloxone in it, plus buprenorphine. The naloxone as well acts as it's what they use a lot of times, like if somebody's overdosing. But it makes it that much trickier. And Subutex can do the same thing. It's just buprenorphine in it, though. No naloxone in it. But as this fentanyl gets stronger, it's getting harder and harder and harder to really judge that timeline of what will cause precipitated withdrawal. Now, I say this because I think Suboxone is a great treatment. I think Subutex is a great treatment. I think methadone, even though it's shown it's a lot stronger and can be abused more than either Suboxone or Subutex, I still think that it's a great treatment. And if it helps you live day to day without going out and using the fentanyl that's on the streets today or heroin, awesome. But the one thing I will say at the same time with these, a lot of times these medications can be abused. I'm not saying everyone will do it. It works for people, but there are some people they're put on that, then they can't get off the Suboxone or Subutex, and the withdrawal can be really tough. And once again, there's others who just don't react well to it, and there's no relief for it, and then they end up just going back to fentanyl or painkillers, you name it. Also with this, so what I want to say with this is, outside of these classes of medications that they use to treat, there's one thing I want to briefly touch on, and it's a supplement. It's called Kratom. Now, I am not against Kratom use, but I also will not promote Kratom use either. There's plenty of studies out there that have shown that it causes withdrawals, just like that you can go through withdrawal when stopping, and it can become very addictive as well, habit forming. However, for people who do not react well to these traditional meds like Suboxone, Subutex, methadone, and they've tried to get off of fentanyl for years and years, and then they're put on Suboxone, methadone, they've got to go every morning to the clinic, they're feeling worse, they have to continue to up their dose, they're groggy. I will say I have seen Kratom has been something that has potential. And I say this because I just think it needs to be studied way more. It's something where there have been people who have transitioned from fentanyl to Suboxone, or they didn't have success, or they went even just from fentanyl to Kratom. And it's unique because it is and it isn't an opioid agonist. It affects the mu receptors in the brain, which is an opioid receptor. It is technically an opioid receptor in the brain. So anyone saying, oh, it doesn't affect your opioid receptors, it does. It does. The problem lies with Kratom, though, is it's in a lot of these smoke shops, and it's not being tested for. It's a legal supplement you can use. You have to be 21 and older. But there are vendors you can get it from online who show their tested results, and you know exactly what you're getting, and it's not something that it's not synthetic, or it's not an extract. It's just the leaf powder. I've seen for people who have been using fentanyl for years have a decently, not an easy transition. It's never easy withdrawal, but I've seen numerous times now patients even discuss, or even just some people some people I know, and just also too, in general, what I've actually, the research and whatnot I've done as well on it, and there's some documentaries you can check out as well. Leaf of Faith is one of them. There's more studies coming out on Kratom. There's a leading scientist from the University of Florida who has a documentary he's making about it as well, about how the unique thing about Kratom is you can't technically overdose on it. Now, that's a strong word, though. That's if you're not, once again, there are some overdose deaths, but that they had fentanyl in their system or something else with it. It was combined with something. Kratom alone, if it is not synthetic, it's been tested. There are no deaths from Kratom alone. There are reports of people, they're blaming it on Kratom, the death, but there were other substances in their system. My point of this being, there needs to be more studies because it does have potential. It doesn't, there's also no, and I know there will be arguments with this as well, and I'm talking about the leaf, just the leaf, I'm not talking about extracts or the 7-OH that people are getting in. I'm talking about just Mitragyna speciosa, the kratom. The leaf powder alone, there's not, it's more for people as they report it, it's more of a relief. There's not a high with it. It's not even comparable to even something like cannabis where you actually, there's an aspect of it where there's a psychoactive reaction to it. With kratom, that's not going on. Kind of like drinking coffee, like it can give you that how I would describe it is it's that motivational, it's like that, when that motivational internal drive to get stuff done with a little bit of a mild caffeine stimulant effect with no come down. Now, at the same time, if you're using it daily long term, yes, you can withdraw from it. It can be a mild like opioid withdrawal. And I don't even really like to say mild like. It can be like an opioid withdrawal. Remember, it affects your mu receptors. Technically a type of opioid receptor, so you can withdraw from it if you're doing it long term. However, there is promise getting off of hard things such as fentanyl. So my whole point of this is I do think in smoke shops, if the kratom isn't tested, it needs to be pulled from the shelf because it gives kratom a bad rep, an extremely bad rep. But at the same time, it should be accessible to the public, and it should be something that hopefully in the future, hospitals, organizations, universities will become a little bit more tolerant of, because they're not going to be able to hide this much longer. They try to show all the bad kratom has done, but there are so many people it has affected in positive ways, in extremely positive ways. And this isn't even people who are addicted, who have opioid addiction. There's people who have chronic migraines, extreme pain where their painkillers aren't helping them much anymore, and they're being cut off from them on top of it, and then they're going to street fentanyl. Instead, they're using something like kratom, a couple grams a day or a couple grams a couple times a day, and it's a lifesaver. They're getting their life back again. So I just encourage anyone out there who is anti-kratom to really look into it. But at the same time, anyone who's for kratom, who thinks everyone should have access to it and that it should all be legalized, I also encourage you to look into it because there is potential for addiction. These extracts are dangerous for people. Who knows what's in them? The only thing I am an advocate for is the leaf, the grinded leaf, in that you're getting it from somebody who actually tests their results and is willing to actually give those to you. I will never promote anyone who sells kratom or whatnot just because of the stigma with that as well. But I will say there needs to be more research with it. It is helping more people than it is hurting. However, I acknowledge at the same time there are people who have traded one addiction for another or even have problems getting off of it. But I think long term it has way more promise than what a lot of times what you're reading on the internet is in general. And unfortunately, a lot of physicians don't want to hear anything about kratom yet either, but they're willing to give out Suboxone or Subutex or Methadone just like really anything. And I'm not hating on that. They haven't really, I believe they haven't really been open to it yet. But I encourage anyone to look it up. And once again, I am not somebody who's endorsing for anyone right now to start kratom if you're using fentanyl or you have pain or whatnot. But at the same time, hopefully there will be more advocates for it where we can really learn long-term how kratom affects the body as well. So that's all I wanted to put out today. I know it might be a little controversial, But I see both sides where Suboxone and Subutex are obviously, and I'm not hating on, by the way, I'm not hating on Suboxone, Subutex, methadone. They're great for people, but at the same time, they're not for everyone. And also with that, Kratom, it can help people, but at the same time, it's not for everyone, where it can cause more problems as well. But yeah, that's the Daily Dose of Mental Health. We cover everything mental health related, substance related. And I encourage you just to look more into different alternatives besides if you're struggling with methadone, Subutex, Suboxone. There are other resources out there, but just make sure, try to avoid smoke shops if you can at all costs. I do not endorse that. That's what gives it a bad rep. Love you all. Leave a comment, like, subscribe. I'll see you next week.